tested for HIV and hepatitis. That's the message some patients of a Philadelphia dental office received after the state suspended that dentist license.
Her office will reopen tomorrow, but the NBC 10 investigators have learned it took almost 2 months after an unannounced inspection for health officials to at least temporarily shutter it. NBC 10 investigative reporter David Charns is asking state regulators and the city why they allowed the office to remain open and see patients while they were investigating. David.
Yeah, documents the NBC 10 investigators obtained reveal inspectors actually identified questionable practices back in March. But the dentist's license wasn't suspended until May, leaving patients who went there during that time asking why she was allowed to see them.
Kathleen Poliski says she takes care of her teeth. Part of that routine is going to the dentist, Dr. Kirti Chopra, in her office in Rittenhouse Square.
She seemed really nice and really caring.
But according to documents from the Pennsylvania Board of Dentistry, a surprise inspection found not so nice results. On March 25th, investigators with the board and the Philadelphia Department of Public Health conducted an unannounced inspection regarding Chopra's, quote, infection control practices. In the suspension order, the board says unsterile instruments and the reuse of single-use medication, quote, place patients at risk for transmission of hepatitis C, hepatitis B, and HIV, as well as other viral, bacterial, or fungal infections. Dr. Chopra tells us there are no known infections, but says she did make a mistake.
All the instruments were sterilized in the office, but the way they were handled and stored were not the way, they wanted us.
I am a germaphobe. So my family joked that this was the worst person for this to happen to.
The board wouldn't say if they asked Chopra to do anything different after their visit and before suspending her license. But patients, such as Poliski, continued to have appointments. On May 15th, 51 days after that inspection and 9 days since Poliski's last visit, the dental board suspended Chopra's license. The health department then put out this news release, urging patients, such as Poliski, to get tested for HIV and hepatitis.
Do you wish this place had been closed immediately?
100%. It would have saved me peace of mind of not freaking out that I contracted a disease.
Neither the Board of Dentistry nor the Pennsylvania Department of State, who oversees them, would speak with the NBC 10 investigators on camera. But in answers to written questions, the state characterized this investigation as a, quote, immediate temporary suspension. They tell the NBC 10 investigators, quote, investigations must be conducted thoroughly and disciplinary action can only be taken once the evidence supports such action. To suspend a license, the state says they must show a dentist poses an immediate and clear danger to public health and safety. Under Pennsylvania law, the Board of Dentistry can suspend a dentist's license, but it cannot shut down a dental office. A spokesperson for the Philadelphia Health Department tells the NBC 10 investigators the city has the authority to order a dentist's office to cease operations, but in this case, it didn't. Before issuing the call for patients to get tested for HIV and other infections, the city says it identified this as a, quote, low-risk situation and deferred all action to the state.
You want no risk.
Dr. Robert Gross studies HIV and other infectious diseases at Penn and says contracting one of those diseases from a dental visit is rare, but not impossible.
Is 7 weeks too long? If I'm the patient, yes. If I'm somebody advocating for the importance of dental care and how dentists get the due diligence of us really evaluating them, I might be on the other side.
Election carries.
Only the NBC 10 investigators were there as the board voted last week to reinstate Chopra's license. The doctor agreed to new procedures, including working with an infection control consultant, training, and surprise inspections.
Worked day and hard to make sure we pass the remediation, fulfill and make sure, we open safely for our patients and provide care with, utmost professionalism and, quality care, because I believe people of Philadelphia deserve that.
Again, Chopra says there is no known transmission from the equipment in her office, and Poliski, the woman you met there, tested negative. As part of the agreement to get her license back, Chopra is on probation for 4 years, and she also must pay a $14,000 fine. For the investigators, I'm David Charns, NBC 10 News.